Practical exams or viva exams in professional courses, especially in medical field or in medical courses, has very crucial role to clear the year and to clear the subject. Hello friends, I am Dr. Prashant. In this video, I am going to discuss about some practical questions and answers of very common disorders. In this video, we are going to see or learn the practical questions and their answers of very common disorder, surgical disorder, that is the hernia. So let us start one by one question and their answer. Define hernia. The answer: abnormal protrusion of whole or part of a viscus through normal or abnormal opening in the wall that contains it. Why inguinal hernias are more common in elderly? Answer: because there is decrease in oxytocin fibers and an increase in the amorphous substance of the elastic fibers as a function of age, which may be responsible for alteration in the resistance of the transversalis fascia. Question: why indirect inguinal hernia is more common on the right side? Answer: due to lateral descent of right testis and a higher incidence of failure of closure of processus vaginalis on right side, the incidence of indirect inguinal hernia is more on right side. Question: how smoking predisposed to development of inguinal hernia and recurrence after repair? Answer: it appears that circulating protease and are released by the lungs, leading to free, active and unbound neutrophil elastase in the plasma of cigarette smokers, and that the systemic protease antiprotease imbalance is response to cigarette smoking. The uninhibited proteolysis leads to emphysema, hernia and abdominal aortic aneurysm. An explanation to relationship between smoking and herniation could be increased collagen degradation and decreased synthesis, which can be shown in the human fibroblasts. Smoking may cause chronic cough that predispose to hernia. Question: which hernias are more common in women than in men? Answer: femoral hernia, incisional hernia, umbilical hernia are the hernias which are common in women than in men. Question: how does obesity predispose to hernia? Answer: excess fat deposits between the muscle bundles and may act to separate muscle bundles and layers, weakens the aponeurosis, thus predispose to hernia. Question: which hernias are more common in obese persons? Answer: inguinal hernia, incisional hernia, hiatus hernia and paraumbilical hernia. These are more common in obese persons. Question: what is the difference between umbilical hernia in children and adult? Answer: in children there is a defect in the umbilicus through which hernia occurs. It may close by itself when the child reaches the age of 5 to 6 years. If the defect does not close by this time, repair should be done. But in case of adult, it occurs not through the umbilical scar but through a defect in the linea alba just above or below or to the side of the umbilicus. So, it is paraumbilical hernia rather than umbilical hernia. Question: is it necessary to differentiate direct from indirect hernia preoperatively? Answer is no. The differentiation is of academic interest only. The true nature of hernia is revealed at operation and is handled accordingly. Question: why do you want to examine the patient with inguinal hernia in standing position? The answer should be To know the extent of the hernia, invisible hernia on opposite side may become visible, and to differentiate inguinal hernia from femoral hernia. In inguinal hernia, the swelling goes above downwards, while in femoral hernia, it goes below upwards. Question: what are the causes of impulse on cuffing in groin region? The answer is expansile impulse on cuffing indicates hernia, and non-expansile impulse on cuffing in inguinal region occurs in hydrocele of cord and undescended testes. Question: what is the diagnostic sign of omentocele? The answer should be irreducibility. Without any other signs or symptoms are almost diagnostic of omentocele, especially in umbilical and femoral hernia. Question: what are the diagnostic criteria for hernia in an infant or child? Answer: inguinal or scrotal lump, history of lump seen by healthcare provider, or history of lump in inguinal or scrotal region seen by mother, or the silk sign positive. The silk sign is the feeling of rubbing together two surfaces of silk cloth. When we gently rubbing together, the two surfaces of hernia sac by finger and thumb at the base of scrotum. Question: when will you say that the hernia is irreducible? The answer: when the hernia is not reducible by the patient himself, if it is not reducible by the surgeon, is not reduced by elevation of foot end of the bed and sedation. Question: why does the femoral hernia initially go down and then goes up? Answer: due to attachment of the superficial fascia of abdomen, that is fascia scarpa, to the fascia lata at the lower border of fossa ovalis, the sac cannot pass down. Question: what is funicular direct inguinal hernia? Answer: herniation of prevesical fat and portion of bladder through a small oval defect in the medial part of conjoint tendon just above the pubic tubercle, also called prevesical hernia. It is prone to strangulation. Question: which are the sackless hernias? Answer: the sackless hernias are epigastric hernia, diaphragmatic hernia, internal hernias, and herniation of brainstem through foramen of magnum. But in the case of epigastric hernia, initially there is a mere protrusion, extraperitoneal pad of fat through the defect in the linea alba. When fully developed, it also contains sac. Question: which hernias are best diagnosed radiologically? The answer is Spigelian hernia and diaphragmatic hernia. These are best diagnosed radiologically. What is inflamed hernia? Hernia that contains inflamed organ. Hernia with appendicitis, salpingitis, or Menkes diverticulitis. Question: what is incarnated hernia? Irreducible hernia without obstruction or strangulation. It is more common in striding hernia containing sigmoid loop. Question: how will you differentiate appendicitis, inflamed hernia from strangulated hernia? Answer: in both types of hernias, the swelling is tender, the skin is edematous and red. Only differentiating point is that swelling is not tense and there are no signs of obstruction in case of inflamed hernia. Question: what is Richer's hernia and why is it dangerous? The answer is the hernia which contains only a part of the circumference of intestinal loop is called Richer's hernia. The Richer's hernia is dangerous because the diagnosis is often delayed till late. The symptoms may mimic gastroenteritis and there may not be and is sign of obstruction. Question: what is Leiter's hernia? Answer: hernia which contains Meckel's diverticulum is called Leiter's hernia. Question: what is acute hernia? The answer should be hernia that appears suddenly after history of coughing or heavy weightlifting is called as acute hernia. Question: what are the groin hernias? The answer is direct and indirect inguinal hernias and femoral hernias are said groin hernias. I hope this will be useful to you for your upcoming practical exams.